Hello, my name is Marisa Mercer. I'm an F&P student at the University of Texas, El Paso. I'm going to be doing today an assessment of the head, ears, eyes, nose, throat, and mouth of my volunteer, Chris, here. Chris, can you verify that you're a volunteer?
Yes.
Okay. So first we're going to start off with the head and the neck. I'm going to first visualize, note the skin. I'm going to note any lesions or nevi on the skin, any abnormalities, going from front, back, side, all aspects. Everything looks good. I do note some nevi here, but they look small, non-protruding. They look evenly distributed. I'm also going to be palpating his skull here for any tenderness. You let me know if there's any tenderness, okay? Palpating the skull for any tenderness here, any depressions. Have you ever had any kind of head injury?
No.
Okay. Any depressions? I'm also feeling the hair for distribution, looking for any kind of irregular hair loss, any scaliness, any bugs. I don't see anything here. Hair looks good. So next I'm going to be moving on to the eyebrows. The eyebrows look symmetrical to me, or at least they look like sisters, siblings. Distribution looks good. I don't note any scaliness. I don't note any lesions, any cuts or abrasions or scars. I'm also going to be looking at the eyes now. Can you close your eyes for me? Good. Both eyelids close equally. One does not stay open versus the other. You can go ahead and open. I'm also noting the eyelashes here. They look nice and full. I don't notice any crustiness on the eyelashes. I'm going to have a look at your conjunctiva here. Can you open your eyes for me? I'm just going to pull your lids down a little bit. The conjunctiva look nice and pink and moist. Also while I'm here, I'm going to look at the lacrimal apparatus, noting for any dryness or excessive teariness, any kind of discharge, and it all looks clear and good. I'm going to pull that on your lid now as well. The conjunctiva looks nice and pink and moist. I'm also noticing the color of his eyes, his iris, his pupil, looking at equalness between the two. Both pupils look equal. His irises are blue. I don't notice any opaqueness there. His sclera are nice and white with no injection. Next, I'm going to have a look at his cervical lymph nodes. I'm going to have you relax your neck. Just kind of, I'm going to feel your cervical lymph nodes here, and here, submandibular. Do you have any tenderness?
No.
Okay. Check your cervical lymph nodes. I don't note any tenderness there, any swelling, any nodules, any redness, any irregularities. I'm also going to go to his trachea now while I'm on his neck. I'm going to have you put your head back just a little bit. I'm going to visualize here. I don't note any deviation in his trachea, but I'm also going to palpate. So can you bring your head forward? Going from the sternocleidomastoid muscle, I'm going to move forward just a little bit and palpate lightly and feel the trachea for any deviation. If there were deviation, it would be difficult to palpate on that one side, and it also would be a medical emergency. It could indicate pneumothorax. I'm going to palpate all the way down here. Do you have any tenderness there?
No.
Okay. Palpate here at this supraclavicular notch. I'm also going to have a listen. Listen for any adventitious breath sounds, any stridor. Can you breathe deep for me? Breathe again. Next, I'm going to assess your thyroid gland. First, visually, if I can visualize it. He has a pretty thick neck, but I can still see here. I can palpate that microcartilage there. I'm going to have him have a glass of water here because we're going to have him swallow. Now I'm going to go behind you and feel. So I want you to go ahead and take a little sip of water, but hold it in your mouth. My fingertips are touching here. All right, now I'm going to have you turn your head to the right slightly, and then go ahead and swallow. Wonderful. I can feel his thyroid cartilage move underneath my hands. All right, have another sip of water. All right, then we're going to go to the left. Go ahead and swallow. Wonderful. So I could feel his thyroid cartilage move underneath my fingers. I didn't note any swelling. I didn't feel any nodules, any abnormal enlargement. Did you feel any tenderness when I palpated?
No.
Okay. Alrighty, so we're going to move on to eyes now, and first I'm going to start doing a visual acuity test with the Snellen eye chart. So if you'll come stand right here. Now normally the Snellen eye chart would be larger and I would have him stand about 20 feet away, but we're going to do it with this little small guy here. So I'm going to have you stand right about there. I want you to cover your left eye and then read the lowest line that you can. Can you let me know what line it is?
Line 8, D, E, F, POTEC.
Okay, that's 2020 on the right. Go ahead and cover the other eye. Read the lowest line that you can and let me know which one.
Line 9.
Okay.
LEFODF, or correction, PCT.
All right. So again, that's 2020. With both eyes, please.
Line 10, FD PLTCEO.
Okay, wonderful. All right, you can go ahead and have another seat. Next, I'm going to go ahead and test visual fields by confrontation. So this, I'm going to sit close to you here so that my visual fields are about the same as yours. Okay, so I want you to close this eye right here. I'm going to close it as well. You can cover, that's fine. And then I want you to let me know when you see my fingers wiggling into your peripheral vision, okay? But look straight at my nose, all right?
Good. See? See?
All right, now read the other eye. Go ahead and cover. All right?
See? See? See?
All right, wonderful. So I don't note any visual loss there. Everything looks good. We're going to go ahead and move on to just inspecting his eyes and eyebrows. I've already inspected his eyebrows when I did his face, but just to come back to it, they look good, evenly distributed, no lesions, no scars. His eyes look nice and midline. His pupils look equal. We're going to go ahead and test those pupils' reaction to light. I'm going to do direct light. All right, bright light. So I notice his pupils before light are about a 3 millimeter, and then with light they shrink down to a 2 or constrict to a 2. Over here in this eye, again the same, about a 3, and they constrict down to a 2. Now I'm going to test consensual, so what I'm going to do is I'm going to shine a light in this eye, but I'm going to see what the other eye does and make sure the pupils should be constricting at the same time. Yep. Okay. Yep. That looks good. They look wonderful. So next I'm going to be inspecting the pupils with my ophthalmoscope, which I don't have. I just have this otoscope, but I will pretend. So I'm going to turn my ophthalmoscope on with the rheostat, and that controls the brightness of the light. I'm going to adjust my diopter to 0 because I don't wear glasses. I'm not nearsighted or farsighted. And I'm going to be assessing his left eye here. So I'm going to be assessing with my left hand, with my left eye, and I'm going to place my hand on his head here and my thumb on his eyebrow so I can get as close as I can without hitting the eye. And then I'm going to go ahead and start about 6 inches away from him until I can see that red reflex, and then I'm going to start honing in until I can see the optic nerve, the optic disc, visualize the vasculature in here, also looking at the fovea and macula. Everything looks good. I don't see any irregularities. I'm going to do the same thing on this side. Looking for that red reflex again, and then once I find that, hone in and adjust my diopter dial to focus. Visualizing the optic disc and optic nerve, looking at the vasculature, fovea, and macula. Everything looks good there. All right, so next we're going to do ears. First I'm going to be just assessing visually here. Pulling up on the auricle here, does that hurt at all?
No.
Okay. Looking for any dips, any lesions, any bumps, navi. Do the same on this side. Do you have any tenderness here?
No.
Okay. Don't note any swelling. Press down on your mastoid bone. Does that hurt at all?
No.
Okay, great. So now I'm going to go visualize into your ear canal. Looking for first the ear canal, any kind of swelling or foreign objects. Any cerumen, which I see a little bit of cerumen, but no foreign objects. It's nice and pink. Looking at the tympanic membrane. Noting the color, glossy gray. Looking at the malleus as well, noting the color. It is nice and pink. Don't notice any perforations in that tympanic membrane. Looking at the canal here. Again, if there's any kind of cerumen, foreign objects, swelling, redness, tympanic membrane, glossy gray, malleus, nice and pink, no perforations. Next, we're going to check hearing. We're going to do the whisper test. I'm going to stand behind you, Chris, about shoulder's length behind you, and then I want you to cover one ear. I'm going to whisper a number and letter sequence, and I want you to repeat it back to me. We're going to do each ear, okay? All right. So I'm standing behind him about shoulder length.
934.
Okay.
ML7.
Okay, we're gonna do the other one.
L9. M3N.
Okay, wonderful. All right, so next I'm going to check for any kind of hearing loss. His whisper test was good, but if I wanted to check for more hearing loss and deaf, I could do a Weber or a Renee test or both. Usually they're combined. So my tuning fork here, I'm gonna go ahead and put it on the top of your head, and I want you to tell me if you can hear in both ears the same or if one's more than the other, okay?
Hear both.
Both the same? Okay, so if I wanted to check to see if he had hearing loss on one side or the other, I could also do the Renee test where I would tap the tuning fork and hold it to the mastoid bone, and he has to let me know when he stops hearing, and then after that, hold it right here, and he has to let me know when he stops hearing on both ears. So we'll go ahead and pretend. Holding this to your mastoid bone, let me know when you stop hearing.
Stop here.
Okay.
Stop here.
Okay, and that's exactly it should be twice as much for the ear conduction. So that would be the Renee test, and that concludes the ear. Now we'll move on to the nose. I'll need my otoscope again. I'm going to be inspecting in front, just looking at the symmetry of his nose. Have you ever had any history of breaking your nose?
No.
Okay. So he's never broken his nose before, and that makes sense. It's nice and straight. I don't see any deviation or asymmetry. I don't see any abnormalities with his nose. Can you put your head back just slightly? Okay. Septum looks nice and centered. All right, now I'm going to go ahead and look in here with my otoscope, and I'm going to look at the nose canal and the septum, looking for any redness, swelling, polyps, any discharge. I don't note any on the left or the right. Everything looks good. I don't notice any white spots. Now I'm going to go a little further back and see if I can visualize his turbinates. We'll try to see his inferior and his medial turbinate and those meatuses. And I can visualize it looks good. I don't see any nasal polyps there or any excessive discharge. And on the other side, it's the same. I do not note any polyps or discharge. Now we're going to assess his sinuses. We'll be doing his frontal sinuses. I need you to let me know if you feel any tenderness or fullness there in your frontal sinuses.
No.
Okay. How about your maxillary sinuses?
No.
Okay, great. So that concludes the nose. We'll move over to the mouth and the pharynx. I'll be assessing first visually, and then I will palpate. I'm gonna need my tongue depressor here and a light. All right, so first I'm gonna be assessing his lips here. I'm noting moisture or dryness. I'm noting any kind of lesions, sores, and any break in the skin here. It all looks wonderful, so I'm gonna have you open your mouth. Okay. And I'm going to visualize into your mouth and note the oral mucosa, buccal mucosa. I'm looking at your gums, gum line, dentation, looking for any swelling, ulcers, redness, any spots, any lesions here. For his dentation, I'm looking for any dental caries, broken teeth, missing teeth, excessive plaque buildup. Everything looks good. He's not missing any teeth. No excessive plaque. Can you stick out your tongue for me? All right. Can you put your tongue back in your mouth? All right. Now I want you to raise the tongue to the roof of your mouth. I'm looking down here at the floor of his mouth. Everything looks good. There's no ulcers here or abrasions or abnormalities. You can put your tongue down. And look at the roof of your mouth. That looks good. It looks nice and pink in color. I don't see any ulcers or lesions. I don't see any bumps. Do you have any tenderness in your mouth?
No.
Okay. All right, now I'm going to look at the soft palate of your mouth, which is way in the back. I'm going to have you open your mouth. Say ah.
Ah.
So I'm testing your vagus nerve there. When you say ah, your uvula should be pulled back midline, and it did when you said ah, so your vagus nerve is intact. So can you stick your tongue out a little bit for me? I'm going to use my depressor here to get a better visualization of the anterior and posterior pillars, which look nice and even. His tonsils are not swollen, they look nice and even. I don't see any redness, I don't see any white patches, any cobblestoning. Okay, you go ahead and close your mouth. Now I'm going to palpate all of these things. Can you open your mouth for me? I'm going to palpate for any swelling here or any bumps, any abnormalities. Alright, can you stick your tongue out? Don't see any lesions on his tongue, but if I did see a lesion on the tongue, it would be important to palpate it because that can often feel bigger than it actually looks. That's wonderful. Okay. Alrighty, next let me check your gag reflex. Can you open your mouth for me? Okay, gag reflex is intact. Alright, and that concludes our HEENT assessment. We'll be posting a neuro assessment in the following video. Thank you so much, Chris, for volunteering. Alright.